Good morning, everybody. I'm Myra Ansari here for Wave Now. I hope that you're doing okay. We are going live to a press conference that's starting here shortly with several local doctors. Dr. Jeff Howard, he's the interim director of the Louisville Metro Department of Public Health and Wellness, and Dr. Stephen Locketis, Assistant Director of Nursing, and Dr. Chris Bryant, an epidemiologist and pediatric infectious disease specialist with Norton Children's Hospital. They're going to be talking about the flu, COVID, RSV cases in Jefferson County, and also some other topics of things that are just really floating around in our area. Let's listen in.
Dr. Jeff Howard. He is our interim director. We also have Dr. Stephanie Lockett. She is our assistant director of nursing. And then we have Dr. Chris Bryant, who is an epidemiologist and pediatric infectious disease specialist with Norton Children's. And with that, Dr. Howard, I'm going to hand it over to you.
Well, first, let me thank everyone for taking the time to join us today. The public health and the Louisville Metro Health Department in particular really appreciates partnership of our local media members and helping us get messages out to our community that are helpful in preventing illnesses. I will tell you, we have enjoyed what has been a pretty significant media break for a while as things sort of cooled down after COVID, as we approach the last few months of COVID-19. However, with the spread of some viral infections in our community, including COVID-19, we thought it was prudent to have an opportunity just to have a discussion with you all about what is going on and making sure our folks in our community understand what's going on from an infectious disease standpoint so they can make decisions regarding their well-being and the well-being of their family. So Kristen did a great job introducing us, but I just want to start by saying, several respiratory illnesses, including the flu, COVID-19, and respiratory syncytial virus, RSV, are circulating in the Jefferson County area and abroad across the nation. We're hoping just to take this time today to provide you with a little update about those illnesses, what's going on, and some general recommendations that the public can take in our community to protect themselves. Let me just start by just start by talking about measles real quick, then we'll circle back to the other respiratory viruses. We have been made aware in recent weeks that there are about 70 or more cases of measles, a virus we don't hear much of because it's vaccine preventable and has been included in routine vaccinations for quite a while. But there's been an outbreak of 70 or more cases of measles in the Columbus, Ohio area. Given that proximity to the Louisville metro area, that alerted our epidemiologists who have been monitoring the situation, offering guidance as we can. And this is the city of Columbus, to be more specific for those. They've had over 25 hospitalizations in that area as a result. So obviously this is something we want to watch closely. We would like the citizens of the Louisville metro area and in our catchment to just be aware that this virus is spreading in an adjacent community. We have not seen any cases in Jefferson County at this point. The virus is typically spreading primarily amongst undervaccinated populations. In order to get ahead of this, we're making sure that folks who are in the Louisville metro area who are traditionally in undervaccinated populations or populations who may be vaccine hesitant for one reason or another, that they are aware of this, and we're making sure that they have opportunities available to get the vaccine. Because measles is not a virus that we see often, I did want to review the symptoms that folks may experience should they get this. And I invite my colleagues who are also experts in this area to weigh in if I miss anything. But folks typically begin to manifest symptoms 10 to 12 days after exposure. These symptoms include fever, cough, runny nose, watery or red eyes, and then a rash that usually breaks out 3 to 5 days after. This rash is fairly characteristic, and folks can find pictures online. The good news is this is a vaccine preventable illness. So there's 2 doses of the measles, mumps, and rubella vaccine that is about 97% effective against preventing measles. So we strongly encourage folks to get that vaccine if they haven't. The vaccine is currently recommended for everyone 12 months or older. And like I said, the Louisville Metro Health Department specifically is working with our communities at risk to make sure that those folks have availability of the vaccine. With that, Kristen, do we want to take questions as we go on these particular areas, or just sort of go through the whole thing and then ask questions at the end?
Yeah, let's ask questions at the end.
Perfect. Circling back to the flu virus, this is influenza season in Kentucky and in the Louisville metro area, and we certainly are seeing quite a bit of cases. To date, there have been reported more than 7,000 cases, along with non-related flu-related deaths. Now, I want to caution those statistics. 7,000 cases is a vast underestimate of the actual flu activity and number of cases in our community. It is important to remember that flu is not a required reportable disease. Some of our hospitals or folks who get tested, for example, at something associated with the health department, those diseases may be reported. But again, this is a vast underestimate of the number of flu-related cases. Now, regarding flu deaths, I think it's important to remember that most patients who will pass due to flu will die from, will have other significant illnesses that ultimately contribute to their death. It's pretty rare for someone to primarily die from the influenza virus itself, but it can happen and certainly is a contributor of death in those that can be at risk. What we would encourage folks who are interested, they could, and we'll provide this link for you, but we do have a flu activity webpage that is available for the public and our media counterparts to access. We still, again, we encourage folks to get vaccinated. It seems like this year's flu vaccine is effective based off the studies I've seen reported out from the CDC. Dr. Bryant, from your reviewing those studies, do you agree that the flu vaccine is effective again this year?
Yes, Dr. Howard, I do agree. That's the data that we're seeing, and that's great news. I think what people need to remember is that an effective flu vaccine prevents serious illness, hospitalization, and death. It won't prevent every case, but it's still worth getting immunized.
I do want to take a moment because this happens in my own family, despite being a public health professional for many years. I hear folks say, I'm not taking the flu vaccine because as soon as I got the vaccine last year, I got sick, and I think the vaccine made me sick. Dr. Bryant, you've worked in infectious disease for a long time and been a public health expert. What do you counsel those patients, and what would you want our media counterparts to know about that so they can, as they're crafting their messages for the public on these issues?
Dr. Howard, I hear the same kinds of statements. So first, the flu vaccine takes about 10 to 14 days to be effective. It takes that long to make antibodies that will fight the flu. And so if somebody gets sick right after they had a flu vaccine, well, their body just didn't have time to make immunity. That's why we encourage people to get immunized early in the season if possible, but it's not too late. Even if you've had flu, we know that different kinds of flu circulate during a season. And if you've had flu now, you can get a vaccine to prevent a different kind of flu in the spring.
Thank you very much. With that said, I'm going to transition from flu, and we're going to talk about COVID-19 for a little bit. And I know to everyone's chagrin, including those in the public, COVID-19 is still here, it's still circulating, and I know we're all seeing news reports of upticks in cases in China and other places abroad. And what I would encourage folks to know is that COVID-19 is still a real part of the viral diseases that are spreading across the world and are still active here in the Jefferson County area. As you know, we have stepped back from providing a direct tracker here in the Louisville metro area just due to resource demands, but we're still utilizing the CDC tracker, and hopefully you all already have the link and are following that website. We're still characterized as in the low or green category. But we are seeing cases increase across the country, including the Jefferson County area. We could see in coming months or weeks that we push up above that. But as of right now, I don't see any evidence of that, and our current numbers suggest that we do belong in that green category. I would say that, but if we do see a significant uptick in COVID, we are going to be once again looking at a situation where our hospital system is going to be significantly stressed because we are seeing high degrees of hospitalizations for RSV. We're seeing high degrees of hospitalization for flu and with COVID-19. Currently, we're still in a good position, but in talking with some of our local hospital leaders, that is a concern that we're all watching. This is all overlaid with the staffing demands that we've seen hospitals face across the country, related to circumstances really created by COVID-19. And I know many of our media counterparts on this call today are already familiar with those issues, and so I won't go into any more detail about them. In terms of what we can do about COVID-19, it's still the same things as before. Practice appropriate hygiene and get vaccinated. Know the symptoms. If you're sick, don't go out and expose other people. And if you're so inclined and you're at risk, please wear a mask if that makes sense for you. Our vaccination rates, we're still sitting at about 66% or so that have completed their series of vaccination. We're at about 80% who've received one dose and about 45% who've actually went through their series and got a booster. So again, we're still encouraging folks to get vaccinated. There's still plenty of COVID vaccines available. Our local hospital systems are still providing the vaccine, and many of our partners in the community who are pharmaceutical providers are also providing the vaccine. So we, again, encourage folks to get vaccinated. One change that has come out in the national media that I do want to emphasize here locally is the Biden administration just had announced that they're restarting the at-home free COVID-19 testing kits. Then they will provide that to households free of cost at a request. We can provide that link in our comments here, but I'm encouraging folks in the Louisville community who are eligible to request their free home COVID tests. Again, that's covidtest.gov, and we'll provide that link. But and I think they'll start shipping out next week for folks who do make that request. And I strongly recommend folks to get those tests if you're eligible, have them on hand. If you're developing symptoms, test yourself, and the test to treat pathway is still available to folks on the front end. So again, can really downgrade some of the harmful effects of COVID-19 if folks will get ahead of this. Again, let me just reemphasize: get vaccinated if you've not got a full set of vaccines. If you're eligible for a booster, get the booster. Get your free COVID home test. If you feel like you have the virus, try to avoid exposing other people to it. And test yourself if you think you have symptoms. If your test is positive, talk to your healthcare provider as soon as possible to see if you're eligible for treatment that may prevent the illness. And then for those that are at risk or those that are so inclined, vaccines masks are a great option for helping prevent both spreading and procuring COVID-19. I'll take a pause here. Stephanie, do you got any comments on COVID-19?
No, I would just say that the cases of COVID-19 that we're seeing that have been at this point, typed have been those strains that are in the bivalent booster vaccine. So if you're eligible for that, definitely encouraging you to do that. And, we've seen an uptick during the holidays. So as we're thinking about the holidays and travel, as Dr. Howard said, make sure you're monitoring your symptoms. And if you don't feel well, stay at home.
Great points. We will provide the link. We have a link on our website that folks can go to be able to access or to be able to identify areas near them where they can get COVID vaccination. So, Kristen, please make sure we provide that link. And most of our media colleagues on this call, I'm pretty sure will already have access to that. And then finally, we'll summarize up. We're talking about respiratory syncytial virus, or RSV. In the recent weeks to months, we've seen quite a bit of increase in RSV outbreaks across our community. This is a disease we typically associate with the pediatric population, and Dr. Bryan is obviously an expert in that area. Dr. Bryan, will you talk about the usual spread of RSV and what we're seeing this season?
Yes, thanks, Dr. Howard. So in a typical year, RSV spread is pretty predictable. We have outbreaks of RSV every single year, but typically that starts in the late fall, early winter, and continues through spring. What we've seen over the last couple of years is that typical pattern has been disrupted. And this year, what we saw was a sharp increase in RSV cases beginning in late summer. And we are continuing to see RSV cases, although overall numbers are starting to come down.
Thank you, Dr. Bryan. With that, I think I'll offer some summary comments, and then we'll go into a question and answer session mediated by Kristen, if that's okay with everyone. So in short, we're seeing an uptick of respiratory spread viruses and illness. in our community. We're also seeing some unusual illnesses pop back up in communities nearby, like measles. We're keeping a close eye on these things. One thing I do want to emphasize for folks, and this came up in a couple of weeks, as many of you know, the health department had a flooding incident, and we were responding to that across the board. And I think it's important for our community to know the health department is still open for business. It may just be a little different. We're reorganizing some. We have reorganized some of our services that we offer to be per appointment, but we are still available to provide services to our community, and we want people in the community to know that we still stand ready to serve them. And I'll tell you, our staff is so unbelievably resilient due to having to overcome the adversities of COVID-19. And when this popped up, it was business as usual. And so again, we still stand ready to serve the community through all this. And we're confident that we have a community who has seen COVID-19, knows how to respond to respiratory viruses. And we think and hope that people hear this message and make decisions that are wise for themselves based on their own risk factor profiles, their comfort, and protects themselves and their family. So with that, Kristen, let's pause and take some questions.
Great. Thank you, Dr. Howard. If you could either put your question in the chat or raise your hand, and then we'll come to you.
I have a question. Can you guys hear me?
Yes.
Okay, sorry. This is Myra from WAVE. We have a question from a viewer who's joining us on social media. She wants to know, you were talking about measles, and the population of the measles outbreak is, in the population of measles outbreak, is it in the vaccinated population? Sorry, it took me a second to get that out.
So I'll go off for some general comments here, then I invite both Dr. Lockett and Dr. Bryan to comment as they see fit. But basically what we're observing from the outbreak that's occurring in Columbus, Ohio, again, this is not occurring in the Jefferson County area as of now. We are just preemptively watching this and wanting the public to know that it is occurring so they can take appropriate action to protect themselves. It is occurring particularly in some immigrant populations. And we are already working with our appropriate offices within LMG and reaching out to those communities to make sure they are aware, and if they might have contact with this community in this specific geographic area that's involved in Columbus, that they have the opportunity to get vaccinated. I think the important thing is if your viewer is worried about it, they just need to get vaccinated. And need to get that, and if they got children, they need to get them vaccinated, and we can provide them resources to help them do that. And Dr. Bryant, Dr. Lockett, any comments on that further?
Thanks, Dr. Howard. I would emphasize that the outbreak in Columbus is occurring primarily in children. And as you said, children who are unimmunized. I think it's important for people to know that outbreaks can occur in any community in which immunization rates drop. So our best protection is just for people to get the recommended immunizations.
Definitely, because we're seeing it in that mostly unvaccinated population, that brings to the forefront the importance of getting those childhood immunizations. And so the health department stands ready to provide those vaccinations for folks through our immunization clinics to try to curtail anything that could occur in an unvaccinated population here in the city.
Yeah, and I think one thing important is the Vaccines for Children program, VFC, that comes through the state, is largely funded via state legislature and through federal funding from the CDC that comes through the state to local health departments, is often given out to our pediatric providers in our community. So there's a lot of resources available for children to get this vaccination. So we really encourage folks to do that. Excellent points.
Great. WLKY, I see you have your hand raised. We're having trouble hearing you.
That sounded like a mouse.
Yeah. We will come back to you. We'll go back to Bria Jones with WFPL.
Can y'all hear me all right?
Yep.
Perfect. Well, I also did not sound like a mouse. I know that when we were having spikes in RSV cases in other parts of the state and over in Indiana, we were seeing schools have to close down because of the number of cases, and we were seeing hospitalization rates among children go up. How are those numbers looking in Jefferson County in regards to children being hospitalized with the flu, RSV, and COVID? And then also, of those three, which ones right now are causing the most hospitalizations and like most severe symptoms? I know with vaccines and stuff, that's starting to look a little bit different about which ones might be causing the most severe reactions in populations.
Well, that's a very complicated question, and hats off to you, Bria, for including a lot in that question. So I think first off, I'll let Dr. Bryant comment specifically on what they're seeing over in the Children's Hospital. In general, flu tends to cause more severe symptoms, at least anecdotally what we're seeing, especially in the unvaccinated population. And the population that are most affected by flu, just like we saw with COVID-19, are folks that are already at high risk for complications. And that's really the focus here is people that are at high risk for complications need to be really careful choosing how they choose to protect themselves, but also and considering masks for themselves and getting their vaccination because they're at higher risk for those complications. In terms of hospitalizations, it sort of fluctuates throughout the season. I'll let Dr. Bryant comment on what we're seeing specifically in the hospital she works at. But we were certainly seeing several weeks ago a very high peak in RSV. Flu came on strong. And COVID is sort of staying at a low steady, maybe slowly creeping up. But we don't have the exact hospitalization data up to date for this week so far, but that's generally what we've been seeing. Dr. Bryant, you got any comments?
Sure. So today at Norton Children's, we have 7 kids hospitalized with COVID-19. As Dr. Howard said, COVID-19 hasn't gone away. We have 5 kids hospitalized with RSV. Those numbers have started to trend down. And we have 14 kids hospitalized with flu. Flu is the big story, and 4 or 5 of those kids are in the ICU. I think it's also important to know that one thing that can happen after flu is serious bacterial infection, and we're certainly seeing that as well. So kids who have flu, maybe they're even starting to get a little bit better, and then they come in with a severe bacterial pneumonia or meningitis or another kind of bacterial infection.
And again, just to emphasize what Dr. Bryant's saying there, she's talking about kids who get a viral infection, viral flu, who then get complicated by a bacterial infection. So this sort of opens you up for getting the flu. Sort of the flu virus can open you up for other complications. Is that right, Dr. Bryant?
Yes, Dr. Howard, thank you.
We got time for probably 2 more, Kristen, I believe.
Yep, we only have about 4 minutes left, so we'll go back to Myra with wave 3.
We also have another question from a viewer. She wanted to know, Chelsea Warren wants to know also, what is the median age of those in part of the measles outbreak? I know you mentioned it was children. And also another question on that, if you have the measles vaccine, does that mean that is it kind of like the flu vaccine that you can still get it or your impact from it would be less, or are you protected 100% if you have the vaccine, if that makes any sense?
Yeah, no, that does make sense. I'll pause and let Dr. Bryant, who's more of an expert in that area, comment on the vaccine in particular, and perhaps Dr. Lockett if she's got any way in. I don't have the specific age group of that outbreak in Columbus, Ohio in front of me now. That's something we can get to you unless Dr. Lockett knows off the top of her head. But the bottom line, we're talking about school-age children. Go ahead, Dr. Lockett, if you got a comment.
No, I think, as you said, school-age children is really the group that we're seeing there with the most cases.
Okay. And we have our last question from WLKY is in the chat. These are some flu-related questions. There are about 7,000 flu-related cases and 9 deaths in Jefferson County. Are those numbers higher than normal, especially pre-pandemic? Also, is there any belief that vaccine fatigue has transferred over to people deciding not to get the flu shot? And also, are flu cases on the rise?
Yeah, so that's a great question, and I think I'll let everybody comment on that one. Let me just take the first shot and say, certainly healthcare virus vaccine fatigue is a real thing, and it's occurring not just in the Louisville Jefferson community, it's across the board. And folks are sick of hearing about it. But the bottom line is these viruses are here to stay. Flu and RSV come every year, and COVID-19 is here for the foreseeable future. And so our job as public health professionals is just making sure we continue to get the message out, or continue to make resources available, and making sure people know the best opportunities to take care of themselves, so they then can make a decision based on their risk factor profile. I have not seen any one patient in particular say, I'm not getting the flu vaccine because I'm tired of hearing about the COVID-19 vaccine, but I do suspect it is happening across our community. What I would encourage people to remember that these are two different viruses, and the best thing you can do to protect yourself always is a vaccine. The flu vaccine's been around a long time. The science that goes into determining which viral components get placed into the vaccine every year is a well-studied scientist and is only improved over time. Again, I think folks, I get the vaccine every year. I encourage my family to do it, and I encourage everybody in our community to do the same unless they got a specific reason they shouldn't. Dr. Bryan, you got any comments on that question?
I think we have been seeing flu immunization rates dropping in, especially in kids. The numbers were lower last year. And I think some of that may have been because we had a couple of unusual flu seasons. Flu was mild, or we didn't see much flu at all. And so I think some parents particularly forget what a severe disease flu can be in children. And so we need to give parents the information they need that flu can be serious or life-threatening, especially in very young kids, those under 5, and those with underlying medical conditions.
All right, Kristen, I know we got the Christmas party to get to, but I hate to leave a couple questions unanswered. Is it okay if we do 2 real quick?
That actually looks like, I think Wave and WLKY had already asked their questions. Is there anyone else that had an additional question?
Well, if not, let me just say to folks, I really appreciate you taking your time today. I know it was sort of last minute, but I know next week everybody who's not already in 100% holiday mode is moving into that mode and are locking down on shopping and everything else. So we just wanted to have some opportunity to chat with our media colleagues and let you know about what's going on, and so you can get the message out to your respective listeners and viewers. And again, we really appreciate the work you do, and thank you again for your time.
Thank you, everyone. And in the chat, I just informed everyone that a press release should be in your inbox now. If you don't get it, you can email me and I'll send that to you and make sure you have it. There's a lot of helpful links there for you. If you have any additional questions that you weren't able to ask that you think of later, please also send those my way and we'll try to get you the answer. Everyone, have a great day. Thank you for joining us again, Dr. Howard, Dr. Bryant, and Dr. Lockett.